welcome to Live Parkinson's, Live an Exceptional Life. I'm your host, Chris Customator, and I've been living an exceptional life with Parkinson's for the past 14 years. The mission of this podcast is to help as many people living with Parkinson's as possible live a great quality of life. Now, today's topic is living with Parkinson's, new treatments and clinical trials you need to know in 2024. Now, before we dive into today's program, I do have a disclaimer, and that is I am not a medical professional. The information being shared is based on my own personal research and my science background and experience. To learn more about whether the treatments being shared are appropriate for you, please consult your healthcare professional. They will be able to tell you if these treatments are appropriate for your specific needs. Living with Parkinson's? Buckle up, because 2024 is shaping up to be a game changer. This year's clinical trials are testing revolutionary treatments that could slow, stop, or maybe even reverse the disease. We are diving deep into the science, exploring your options, and empowering you to take control of your future. So join us for Living with Parkinson's, new treatments and clinical trials you need to know in 2024. Now, before we dive into the new treatment options and clinical trials, I want to provide an overview of what we will be covering in this podcast. I've divided it into 3 segments. First, we'll explore promising new treatment approaches. I'll discuss emerging areas of research, including gene therapy and gene editing, gut microbiome and its potential role in Parkinson's. Then we will highlight neuroinflammation and targeted immune therapies. Finally, we'll look at repurposing existing drugs for Parkinson treatment for each of these treatments and approaches and potential therapies. I'll explain in layman's terms what the clinical approach is and what the potential benefits are of each of the research areas, and I will provide specific examples of drugs or therapies currently in clinical trials and when they may become available. Then, in Section 2, we'll turn the spotlight on recent clinical trials from 2023 and 2024. And then finally, I'll discuss participating in clinical trials and share my experience with clinical research, including a study for a drug that was approved for market by the FDA. So I hope you'll join me as we explore these exciting new therapies. Now, my promise to you is to keep this as simple and easy to understand as possible, and hopefully provide you with the information to show you that there is hope on the horizon for helping you overcome the daily struggles and challenges that we all face with Parkinson's. So if you're ready, let's roll up our sleeves and get started learning some of the promising new treatment approaches that are underway to help you live your best life. Let's start with an exciting area of research, gene therapy and gene editing. So we're all on the same page. I think an important first step is to define what gene therapy and gene editing are. And that way it'll help us to better understand how it's being used in Parkinson's research. Both gene therapy and gene editing are techniques that test and manipulate human genes to treat or cure diseases, including Parkinson's. Gene therapy involves replacing, silencing, or correcting a flawed gene with a good one. So essentially, to boil it down, it's replacing bad DNA with good DNA. And you know that DNA makes us who we are. Okay, so it sounds simple enough. We have this gene in our body that's causing problems. Now, to fix the problem, we don't want to give the gene a chance to say, I'm sorry, I won't cause any more problems. We go in and take it out and take out the troublemaker and replace it with a friendly one who will be a team player, or just silence the gene so it can't cause any problems, or send the gene back to school for more training so it can learn enough to correct its mistakes. That is how gene therapy is being used in Parkinson's research. Now, I kid there a little bit, but that's what they would typically do. They can either replace it, train, or silence it. Now, let's look at some of the research going on to help people living with Parkinson's. One of the things they're looking at is regrowing the dopamine system. And what this research involves is injecting a gene that stimulates brain cells to regrow the dopamine system. Another area they're looking at is replacing lost dopamine, and that involves injecting a gene that converts existing cells to produce dopamine. And then finally, infections, non-nerve brain cells. And this involves injecting cells to create a synthetic pathway for dopamine to travel and get into the cells. Scientists that are involved in studying potential gene and cell therapies base their work on understanding that Parkinson's originates from a genetic predisposition that impacts a protein found in the brain called alpha-synuclein. Now, you may have heard Michael J. Fox and others talk about alpha-synuclein. Now, for people living with Parkinson's, alpha-synuclein builds up or misfolds into clusters, and then these clusters are called Lewy bodies. And when Lewy bodies build up and spread, it leads to the death of dopamine-producing cells. And as many of us living with Parkinson's know, that dopamine helps us not only move, it's also involved in balance, moods, and is also involved in our emotional health. So as greater numbers of these dopamine-producing cells die off, a person begins to show signs of Parkinson's, particularly the motor symptoms. The current therapies for treating Parkinson's are targeted to help relieve the symptoms by replacing lost dopamine through medication and or lifestyle changes. And that could include exercise, good nutrition, and meditation and mindfulness. Now, some new frontiers in Parkinson's therapy include improved medications to target the dopamine system and treat dyskinesia, which are involuntary movements of the face, trunk, and limbs that are associated with levodopa use. Another thing they're looking at is experimental closed-loop deep brain stimulation, where a DBS system can learn what's happening in the brain and control stimulation applied to the brain and improve symptoms such as dyskinesia. Another is therapies targeting alpha-synuclein through reducing its production, slowing the buildup, or stopping the spread. Now, researchers are also evaluating other approaches within investigational gene and cell-based therapies targeting PD, which include replacing lost dopamine and rescuing dying cells, and then growing dopamine-producing pathways again, as I mentioned earlier. Now, one of the benefits gene therapy has over using medications to treat motor symptoms is the advantage of eliminating significant PD symptoms with fewer to no adverse effects than conventional treatments, because we know that some of the conventional treatments have side effects such as dyskinesia and issues with sleep and so on. So let's look at another emerging area of research, which is the gut microbiome. And you're probably thinking to yourself, the gut what? What's a gut microbiome? Well, simply put, gut microbiome refers to the vast community of microorganisms, that's bacteria, fungi, and viruses that reside in your gut or your GI tract. Now, these microbes play a crucial role in the digestion of your food, nutrient absorption, and immune function, and even brain health. Now, here's a little piece of information that may surprise you, but up to 70 to 80% of our immune system resides in our GI tract. Now, the gut microbiome is unique to each of us and can be influenced by our diet, lifestyle, and environmental factors. Now that we know what the gut microbiome is, how is it involved in Parkinson's research? Well, recent studies have identified significant differences in the gut microbiome of people with Parkinson's compared to healthy individuals. Now, the differences that they've noted have sparked interest in the potential role of gut bacteria in the development and progression of Parkinson's disease. Now, here are some of the key areas currently being investigated as part of the gut microbiome research. The first area is inflammation. Certain gut bacteria may contribute to chronic inflammation, which is linked to the neurodegenerative processes that we see in Parkinson's. Identifying ways to help reduce inflammation may help provide treatment options. Alpha-synuclein, the protein that when it misfolds or clumps, forms the hallmark of Lewy bodies in the brain of people with Parkinson's. Research suggests, and that's the key word here, suggests that gut bacteria may be involved in the alpha-synuclein production and clumping. Solving this riddle may be the pathway to help solve or slow the progression of Parkinson's. And then finally, the gut-brain axis. The gut and the brain communicate through various pathways, including the vagus nerve and the immune system. Think of these pathways like highways on the road, where trucks deliver fuel, food, and supplies to stores. The gut-brain axis uses these pathways for immunity as well as supplying essential nutrients for brain health. Now, the communication between the brain and the gut may influence the development and progression of Parkinson's. where they are in terms of current research on the gut microbiome brain connection? Well, research on the gut microbiome in Parkinson's is still in its early stages, but it holds promising potential for number one, identifying new biomarkers for early PD diagnosis. Number two, developing novel therapeutic strategies targeting the gut microbiome to potentially slow or even prevent PD progression. Understanding the complex interplay between gut health and brain health, and while the exact mechanisms are being investigated, the link between gut microbiome and PD is a fascinating area of research that could, and that's the key term here again, could lead to significant breakthroughs in managing and potentially even preventing Parkinson's. Now, are you ready to look at another new emerging research area? Well, let's keep it going and then look at neuroinflammation and targeted immune therapies. Now, what is neuroinflammation? Sounds kind of serious, doesn't it? Well, actually, it is no walk in the park. It refers to chronic inflammation occurring within the central nervous system, specifically the brain and spinal cord. And if you think of diseases like meningitis, that attacks the central nervous system as well. If it involves the activation of immune cells, normally protect the central nervous system, but can become overly reactive and release harmful substances. Now, this excessive inflammation damages the surrounding neurons and contributes to neurodegeneration, which occurs in Parkinson's. So, how is neuroinflammation involved in Parkinson's research? Well, mounting evidence suggests neuroinflammation plays a crucial role in Parkinson's disease progression. Studies have shown elevated levels of inflammation in inflammatory markers in the brains and cerebrospinal fluids of PD patients. Activated immune cells surround damaged dopaminergic neurons in the substantia nigra, the brain region affected in PD. There is a potential link between neuroinflammation and other PD hallmarks like alpha-synuclein aggregation and oxidative stress. Now, based on the growing understanding of neuroinflammation and its role in PD, researchers are exploring targeted immune therapies as potential treatments. Now, these treatments aim to modulate the immune response in the central nervous system, reduce harmful effects of activated immune cells, and then protect dopaminergic neurons from inflammatory damage. So essentially what we're saying here is that they're trying to keep the immune response down so that the cells don't do damage to the nervous system. And then it's also helping to prevent the harmful effects once the cells have been activated. So let's look at some examples of targeted immunity currently being investigated. The first is microglial inhibitors. Now that's a mouthful. Microglial inhibitors. Drugs designed to suppress and overcome the immune cells and prevent them from releasing the harmful substances that are going to damage the neurons. Anti-inflammatory drugs. These are medications that dampen the overall inflammatory response within the brain. So if we can prevent the inflammation, we can hopefully prevent the harmful damage done by the inflammation on the central nervous system. And then immunomodulatory therapies. Now that's a tongue twister. Immunomodulatory therapies. And these are just treatments that aim to regulate the immune system and potentially prevent the initial inflammatory attack on the dopaminergic neurons. Now, research on targeted immune therapies for PD is still in its early stages, but it holds significant promise for slowing down or even halting the progression of PD, potentially offering disease-modifying treatments unlike current medication that only manage symptoms and opening new avenues for therapeutic interventions in PD. Now, let's look at our last area of emerging research, which is repurposing existing drugs for Parkinson treatment. Repurposing of existing drugs for Parkinson's offers several advantages. Number one, faster development. Because existing drugs already have undergone extensive safety and efficacy testing, significantly reducing the time and the cost needed for the Parkinson's specific trials. Because there's already safety information on those drugs that are currently out there, if they can just run a Parkinson's specific study and then submit that that makes the approval process go that much faster. Number two is reduce risk. The safety profile of these drugs is already established, minimizing the risk of unexpected adverse events. So since these drugs are already on the market, and if they can be used to help treat Parkinson's symptoms, then it's going to reduce the risk of a lot of the adverse effects that we may see. Number three is new applications. So by studying the mechanisms of action of existing drugs, researchers can identify potential benefits for different conditions like Parkinson's. So let's take a look at some examples of how existing drugs are being repurposed for Parkinson's. The first one is a drug that I take, amantadine, and this was a drug that was originally developed as an antiviral medication for the flu. It was later found to improve motor symptoms in Parkinson's patients, and this is one of the drugs that I take to help me with tremors and gait problems. Okay, the next one is exenatide, liraglutide, and lixisenatide. Now, these drugs are used for type 2 diabetes and are being investigated for their potential to protect dopaminergic neurons and slow disease progression. Another one is ambroxol. Now, this medication is used for respiratory conditions and has shown promise in enhancing the activity of a key enzyme involved in Parkinson's pathway. Then we have buspirone. This is an anti-anxiety medication, and it's being studied for its potential to manage levodopa-induced dyskinesias, a common side effect of that Parkinson's treatment. And then the process of repurposing drugs involves, number one, you want to identify potential candidates. Researchers are always screening current and existing drugs, and based on their mechanism of action and potential effects on Parkinson's, they can say, oh, this drug it was originally designed for diabetes, but it may have an impact on people with Parkinson's. Number two, preclinical testing. Initial studies can be conducted in cell cultures and animal models to assess safety and potential efficacy for Parkinson's. And then number three, clinical trials. If preclinical results are promising, the drug progresses through different phases of clinical trials to evaluate its safety and efficacy in humans with Parkinson's. Now, while repurposing drugs offer a promising avenue for accelerating Parkinson's treatment development, it's important to note that not all repurposed drugs will be successful in treating Parkinson's, and that further research and larger clinical trials are necessary to confirm their long-term efficacy and safety. All right. Now that we've explored some of the promising new treatment approaches, let's turn our attention to some of the most noteworthy ongoing clinical trials in 2023 and 24. And let's start with one of the trials that is getting some major attention in the news. Many of you have heard or read or seen about two drugs that are approved to treat type 2 diabetes, but are also being used because they've demonstrated weight loss in people using the drugs. And the two most popular that you've heard of are Ozempic, and the other is Wegovy. They're being investigated for potential use in Parkinson's patients. So according to the article, could drugs like Ozempic help people with Parkinson's disease? And that was just recently published on April 5th, 2024 by the American Parkinson's Disease Association. And these drugs are what they call GLP-1 agonists. And what they do is they mimic your gut hormone to stimulate the release of insulin. And the receptors for GLP-1 also found in the brain, and there has been a growing body of evidence showing that these molecules can have neuroprotective effects, according to the article. Now, a clinical trial including a GP1 agonist, lixisenatide, recently completed, and the results were published in the New England Journal of Medicine. The study followed 156 people with Parkinson's within the first 3 years of diagnosis. The study group was divided and randomly assigned to receive either the drug or placebo. At 12 months, motor scores in the placebo group had worsened, but in the people receiving the drug, lixisenatide, they did not. And one of the common side effects or symptoms that was seen with the study drug was nausea, which occurred in 46% of the study patients receiving the lixisenatide. Now, according to the APDA article, a larger trial will need to be conducted to confirm the results of this smaller study. The article notes that if the GLP-1 inhibitor is found to be useful in Parkinson's, that would be very welcome news. The article goes on to state that if results can be confirmed, the process for getting FDA approval could be done quicker since there is an approved drug and safety profile is already established. So it's a simpler process, and the process of repurposing a medication that we talked about earlier could be used to help get approval for this particular drug. Now, several other exciting trials in 2023 are ongoing, and I'll give you a brief overview. One is called STEM-PD clinical trial, and this is the first in-human clinical trial testing a new investigational therapy for Parkinson's disease aimed at replacing dopamine. Now, the first patients in the trial were transplanted with the stem cells in Sweden in February 2023. They've completed dosing the first 4 patients with the initial lower dose of stem cells. And then based on the safety data that they got back, the study team has now initiated dosing on the next 4 patients at higher doses of stem cells. Now, the patients in the higher dose group will be followed for 36 months. And the primary outcome of this study is to assess the safety and tolerability of the stem cell product STEM-PD over 1 year post-grafting. And secondary objectives of the trial include assessment of transplanted cell survival through the dopamine PET imaging, as well as clinical efficacy 3 years after a transplant with stem cells. The next one is Bemdaneprocel, a promising stem cell derived therapy for Parkinson's, continues to show positive results 18 months after treatment. Data presented at the recent Alzheimer's and Parkinson's disease conference demonstrated that the dopamine-producing neural cell therapy remained safe and well tolerated by participants in the phase 1 clinical trial at 18 months. The data also showed the transplanted stem cells survived and have become grafted in the brain and continue to signal increased dopaminergic activity after immune suppression therapy was curtailed at 12 months. Now, in addition, both low and high doses of the Bemdaneprocel patients showed improvements in motor function test with the higher dose, and also they showed greater gains than the ones with the lower dose. Dr. Claire Henchcliffe, one of the study's principal investigators, said, "It's exciting that Bemdaneprocel met safety and tolerability criteria at 12 months, and now the 18th month results suggest that the allogenic or stem cells survive and have potentially positive effects even after discontinuation of immunosuppressants." She also stated, "We should not over-interpret results of a phase 1 clinical study, but this is a promising step that deserves to be followed up with future clinical studies." Before we move into our last segment, I wanted to share with you an exciting offer from Audible.com. If you're not familiar with Audible.com, they're your one-stop resource in audio entertainment. They have thousands of titles of audiobooks as well as podcasts. In addition, they have Audible originals from your favorite celebrities. Audible.com is offering listeners a free audiobook and a free 30-day trial of Audible.com. Now, 2 of the audiobooks that I highly recommend are Happiness of Pursuit by Davis Finney, and also their podcast, The Parkinson's Project, and 2 10 Breakthrough Therapies for Parkinson's Disease by Dr. Michael Oken. Now, to get your free audiobook and free 30-day trial, visit audibletrial.com/exceptionallife. That's audibletrial.com/exceptionallife, and I'll leave a link in the podcast description. Now, for complete transparency and personal integrity, I wanted to let you know that if you sign up for the free audiobook and the free 30-day trial, Audible pays me a small commission, which I use to support this podcast. So if you decide to sign up, I thank you for supporting this podcast, but you're under no obligation to join. And if you decide not to join, you still get to keep the free audiobook. So thank you very much. Now let's dive into our final segment on participating in clinical trials. And let's start out by asking why they're important. Clinical trials are vital for developing new and effective treatments for Parkinson's. They involve meticulously testing safety and efficacy of potential therapies of human participants. So here's a look at the different phases of clinical testing, since you may have heard me talking about phase 1, phase 2, phase 3 studies. Phase 1 studies involve a small group of healthy volunteers, usually 20 to 100 people, and they're designed to assess the safety and efficacy and side effect profile of a new drug treatment. Researchers determine the appropriate dosage and identify potential risks associated with taking the drug. And then participation typically involves regular clinic visits, blood tests, and monitoring for side effects. Now, phase 2 studies then expand the study group to a larger group from usually 20 to 100 to 100 to 300 people with Parkinson's, and they evaluate the effectiveness of the treatment in improving symptoms or slowing disease progression. Now, participants may receive either the new treatment or placebo to compare effects. And then this type of study requires more clinic visits and adherence to specific protocols. Phase 3 studies involve a much larger group, usually several hundred to thousands, and they're usually across multiple research centers. What phase 3 studies are designed to do is confirm the effectiveness and safety of the treatment compared to a standard treatment or placebo. Now, participation demands strict adherence to the study protocol and incorporates regular clinic visits. And then phase 4 studies, they're also known as post-marketing surveillance. After a treatment receives regulatory approval, the company's going to monitor the long-term safety and effectiveness of the treatment in a real-world setting. Now, I want to state that participation in a clinical trial is a personal choice, and you should only be doing it if it's something that you feel comfortable doing. You shouldn't feel pressured into participating. Now, if you do decide to participate, what are some of the benefits and considerations that you need to keep in mind? Well, the first benefit is you get access to potentially life-changing treatments before they're widely available. Secondly, they contribute directly to advancing Parkinson's research and treatment options. And then finally, they receive close medical monitoring and expert care from the study team. Now, what are some considerations before you go jumping into some of the clinical studies? Well, there are potential for side effects from the new treatment, the time commitment for clinical visits, and adherence to study protocols. And I can vouch for that. I did a number of clinical study visits and in a year and a half. So I certainly understand. Now, and you may not receive the new treatment if you're assigned in the placebo group. You're not going to be evaluating the treatment anyway. Now, I wanted to briefly share my personal experience with clinical studies. I participated in phase 1, 2, and 3 clinical trials ranging from some genetic testing, mobility studies, and a new drug study. I was fortunate that I was able to participate in a phase 3 clinical trial for a new drug that was an inhaler that ended up getting approved by the FDA. Now, I participated in both the double-blind, placebo-controlled portion, which was 6 months long and included clinic visits and exams, lung function tests, and I was requested to keep a daily diary and logbook of my symptoms. At the conclusion of the double-blind portion of the study, I signed up for the 1-year-long open-label study. And so you knew you were getting the study drug in that when you're in the open-label portion. And then I've had the positive experiences with all the clinical studies I participated in. The staff is always knowledgeable. They can tell you the risks, and they're always available if you need them. One of the things that I find from doing clinical studies is that they give me a sense of personal satisfaction, knowing that I'm helping push the Parkinson's treatment a rock further down the road. So if you're interested in participating, visit the Michael J. Fox Foundation Trial Finder, clinicaltrials.gov, and the Parkinson's Foundation. And I'll put links in the description for the podcast. And living with Parkinson's doesn't have to mean settling for the status quo. In this episode, we explored the exciting advancements happening in Parkinson's research, from the potential of gut microbiome to targeted immune therapies. We discuss the promise of repurposing existing drugs, and we discuss the promise of clinical trials and developing new treatments. But the fight isn't over. We need your voice, and here's your call to action. Share this podcast. Help raise awareness about the progress being made in Parkinson's research. Number 2, talk to your doctor. You can discuss some of the latest research findings and get their opinion on what they think of the particular drug, and especially what do they think it's going to get approved. And then number 3 is consider participating in a clinical trial. Be part of the solution for a brighter solution for yourself and others with PD. Only if you feel comfortable, of course. Now, together we can turn the tide on this disease. Let's keep the momentum going. And please visit me at liveparkinsons.com. There's a bunch of free resources on there. I've just updated the homepage. I'm adding a resource page, but you can go on and sign up for the free monthly newsletter. The 9 balance exercises for Parkinson's is on there you can sign up for. And I also have a medication symptom tracker that you can use to prepare for your visit. So if you visit liveparkinsons.com, all those are free resources that you can take advantage of. And then also please visit my YouTube channel, Live Parkinson's, Live an Exceptional Life. Even though it's in initial stages, there's a number of videos on there and shorts that can help you with stretching and balance and some other things. And then finally, I'd love to hear from each and every one of you. And because what I would like to do is find out, what are your pain points? What are some of the problems that you're running into, so that I can develop podcasts that help meet your needs. But I would just love to hear any success stories that you have that we could share with others, or what's working, what doesn't seem to work. And so if you would visit fanlist.com/liveparkinsonslife. Again, that's fanlist.com/liveparkinsonslife. And leave me a comment, and I'll be sure to get back to you. And I'm really interested in topics that you'd like to hear. So I want to make this as consumer and customer friendly as possible and give you the information that you're looking for. So if you could help me out that way, I would appreciate it. And we're trying to build a nice tribe of Parkinson's warriors to keep each other held accountable and motivated. So that's a wrap for this episode, and I greatly appreciate you all listening. And it's been great to see people from all over the world join and listen. So thanks again, and you all have a spectacular day, and I will see you in the near future. Thanks.